Welcome back indeed. The nationwide strike by the National Association of Nigerian Nurses and Midwives in the course of the week crippled healthcare services across multiple states. The workers were demanding improved staffing, better facilities and recognition in healthcare decision-making embarked on the 7-day warning strike after the expiration of a 15-day ultimatum issued to government. However, 4 days into the warning strike, the workers' union suspended the nationwide warning strike. The decision followed a virtual emergency meeting of the National Executive Council during which the association reviewed its engagements with the federal government. In a circular, the council said the suspension of the strike was agreed after a thorough consideration of the signed Memorandum of Understanding with the government and the agreed timeline for implementation of key issues. Officials of the association met with representatives of the Federal Ministry of Health and Social Welfare, Ministry of Labor and Employment, Office of the Head of Civil Service of the Federation, Office of the Accountant General, National Salaries, Incomes and Wages Commission, and other relevant stakeholders in a bid to resolve the issue. Ibrahim Gadaba, very quickly. Now, one of the key demands of the nurses is clamoring for more hands with severe manpower shortages in the system, citing the World Health Organization's recommendation of 4 nurses per patient compared to the reality in Nigerian hospitals where one nurse may be responsible for 30 patients. Now, what gravity of situation do we have on our hands here?
Look, Mark, you have said it all. You see, we should declare a state of emergency in the health sector because on a daily basis, we are losing personnel to foreign nations, very good hands leaving the country every day, all in the name of a better welfare package. I think we should be Nigerians for the first time. Going out is good, but again, if you look at the workforce, the health industry, for instance, where we have a huge shortage, a huge gap in the health sector, there's a need for government to make pronouncement, like I said, declare a state of emergency, because as it stands now, the private hospitals are taking even more of health professionals from the public hospitals. So it's a very, very big challenge. And the government should begin to look at between the public and the private hospitals, you know, what is really going on. When this strike took place, Mark, I went around, some of the nurses I knew I spoke to, you know, they told me some of the private hospitals we have in Abuja are taking more and more patients to their clinics. Why? Because it opened a new door for them to get more customers. So I think we should, as a matter of fact, sit down with these people, especially the one we have now, improve on their welfare package, because yes, they deserve whatever was put forward. But at the same time, they should know that they should understand the nature, the economy which we have today. We don't have too much money to manage the institutions, but at the same time, government should find a way of harmonizing some of these requests which has been put forward, and see how they can leverage on the existing infrastructure. Otherwise, we are going to lose more and more personnel to foreign nations.
All right. Now, Joseph Femi, now, there is also issues bothering around hierarchy, all right, where doctors are able to get to the pinnacle of their profession as directors level. Nurses are also saying they deserve to rise. I mean, after all, we are all connected in this web of getting back, you know, on their getting people back on their feet. Now, how do you think this can be addressed? Because they're also saying we are relevant. If doctors can rise to the pinnacle of the careers, why should we also not get to at the top of our careers as well and enjoy our job and probably rest and have a good time?
Well, what they're saying is apt and correct. If you look at the health setting, I mean, 70% of nurses makes up
the health sector.
The health sector.
Yeah, they are they are very core present.
So how would you say that a doctor will feel more relevant than a nurse, and they don't treat them, you understand, they treat them like second class, not first class
citizens?
It's not like that abroad. And that's why a lot of them are looking for opportunity to.
Talking about leaving Nigeria,
yes.
Why is it that the health professionals, the so-called grounded men who are in the health business, seeing the modus operandi outside the country, and people keep flocking out? Why is it not bothering them that we can replicate this same structure here and give these nurses a reason to believe that this system works for them too?
Mark, I'll say this to you categorically. I felt like at a point, the current government should have come up with a roadmap, a structure before coming to power.
But this has been an ongoing issue. So it didn't start today.
This is where I'm going to. Where I'm going to is this. Before you can do major reforms, we agree that the health sector needs major reforms. Before you can do that, you need money, you need finance to do it. That is why I think, in my own opinion, the president went for tax reform first, generate more money so that you can use to reform other sectors. These people are asking for money. They're asking for good allowances. They're asking to recruit and train more nurses. It is money that you use to do
that.
How much is Nigeria generating? Nigeria is not generating money enough. That was why the president went for tax first. Generate ×3 or ×4 or ×5 what they're generating currently, then use the fund to do more reforms. That's the only caveat I have for the president for long to have reformed a lot of sectors. Health, security, police, every sector needs reform in Nigeria. All these issues have lingered a long time before now.
All right. Now, Ganbad, please, quickly, they are also seeking demand for hazard allowances, particularly for nurses working at the local government level. Now, digressing a bit with the controversial $2.896 billion allocated for the rehabilitation of Nigeria's 3 major refineries. Now, what could be the reason behind key sectors not getting same attention, especially knowing their importance?
It's the Nigerian concept. We try to, glamorize the medical doctors as against the nurses and midwives, just like he mentioned earlier. There's a need for a proper synergy and to find a way around it. Because for somebody to be in the medical school for a while, for up to 6-7 years, and for the nurses to spend a few years in school, there's that disparity. And there's a level to which each among these two can operate. So we should be fair to the medical doctors. At the same time, the nurses, I think they have about 9 points demand. It's not possible for the federal government to attend to all these, but we should focus on some very few, especially the hazard allowances, because the nurses, they pass through a lot. Medical doctors they will come in, spend some few minutes. The nurses attend to the patients both at home and in the hospital. So I think they need to be properly remunerated so that we can keep them at home and render good service to Nigerians.
All right, let's coast home with our final story for the day. Dangote Petroleum Refinery and Petrochemicals has withdrawn its lawsuit against the Nigerian Midstream and Downstream Petroleum Regulatory Authority, NNPPRA, the Nigerian National Petroleum Company Limited, NNPCL, and 5 other petroleum companies, according to a notice of discontinuance filed before the Federal High Court, Abuja. Dangote Refinery